Welcome to Live with Hillsdale Hospital. Today is January 24th. Isn't that hard to believe?
It is.
We're already through the first of the year. How many times did you use that joke? Have a good year, or, see you next year, any of that stuff?
I don't say cheesy things like that.
You could have just seen what she was doing in the studio 2 minutes ago. Jamie Caldwell, it is so good to have you here.
Thank you.
This is designed to keep our community updated on what's happening in healthcare each and every week. And we like to bring guests in who are informational and can provide really information about access to Hillsdale Hospital services. And I am pleased today to be able to introduce a good friend of mine, a colleague and a hard worker right here at Hillsdale Hospital, 23-year veteran. 23 years. We're going to talk about that in a minute. Jamie Caldwell, it's great to have you here in the studio. And this, I know you've been here before, but today we're going to talk about something that's heavy on the minds of you, me, and our community. Before we do that, could you talk a little bit about your background, how long you've been here, and what you do every day?
Sure. Well, as you mentioned, I've been here 23 years, almost 24. Started off in the radiology department as a rad tech assistant. So I just worked to assist the technologists. I completed my program at Jackson College, became board certified, cross-trained into CT, MRI, and had the opportunity to move into the management position about 6 or 7 years ago, and I'm working with a great team.
And you've done a remarkable job, and I've said this in many of the writings that I push out to our staff, to our board, talking about the work that you've done to really bring the team together and to expand the modalities that we do and to reach a bigger audience than we've ever reached. And we're doing some amazing things. With that growth comes a lot of growing pains, and something has happened in our industry, and specifically your industry, as it relates to radiologists, and that impacts things like read times, turnaround times for you as a public. And I've been getting some comment cards, we've been getting some email chatter, and even some Facebook posts about it. And I really wanted to use this time to try to explain to our community what is happening in our industry, and then what are we doing specifically at Hillsdale. So, we now know it's taking a little longer than it used to
Absolutely.
get a return on some of those, what we would call reads. So in other words, the results of your testing. Jamie, talk to us a little bit about what has changed, why we're there today, what we're doing about it, if you could.
Sure. So nationwide, we're experiencing a radiologist shortage.
We are.
That is not impacting just Hillsdale Hospital. It's impacting a lot of hospitals around us, even close competitors to us. And with that being said, when there's not enough radiologists to read, they're spread pretty thin, and it's causing longer time in getting your results back.
Yeah, it is. And so, the company that we had before, because I've often heard, why'd you have to fire them, JJ? Please explain why we arrived at that situation.
Sure. So the group that we had previously made the decision to dissolve their company.
Yeah.
And when they did that, they all went their separate ways, which meant us starting over from scratch, finding a new group that could check all the boxes that we needed here at Hillsdale Hospital.
And speaking of that, almost 3 dozen. You were out and about. I think you had 30 different vendors you were looking at, and you interviewed every one of those in a very short time frame to get this done, because our notification period wasn't very long.
No.
And so you interviewed them, and it was looking pretty grim for us, because it was looking like we have to go into telemedicine exclusively. Talk to us about what we ended up with, and why are we seeing some of that delay?
Sure. So with the technology that we have now, it's not uncommon for radiologists to read remotely, meaning they can read from the privacy of their own home if they want to through the technology. But unfortunately, that model alone will not work for Hillsdale Hospital. There are services that we provide to our community that are upfront and in person, which means having a provider here allows us to do special procedures like biopsies, abscess drains, fluoroscopy, things like that. We need somebody on site. So the model we had to find was someone who could be on site and have providers that were remote as well. So it was tough finding that.
It was tough, but you were successful finally. We were looking at the 11th hour at signing on with one of these radiology groups, which would not have a physical presence at Hillsdale. And that concerned you and I, because we know that Hillsdale model has always been, really hands-on.
Yep.
And so we were fortunate, because we had, through a mutual contact, received the name of a radiologist that had his own company. And so you enter an agreement with someone somewhat local, and talk to us about how that is going, and, talk about the model that they have.
Sure. So the model they have is exactly what we wanted, someone on site for us to provide the services to our community, but they do a lot of their reading remotely. Unfortunately, we do have a significant, well, it's not unfortunate, but we have a significant volume here. And it's very difficult for that number of radiologists to keep up with the work that we're doing here. So that being said, they're spread thin, and most radiology groups are reading for multiple places, right? Which spreads them even thinner. So what we're experiencing is a delay in that read time.
But let's talk about delays, because you and I have been in numerous meetings with other professionals from other health systems who are giving numbers that are, wow, crazy length of time. For example, we've heard up to 5, 6, 7 weeks for some return on testing. Where would we compare to someone of a peer like that?
It really just depends on the facility as well as the type of modality that we're referring to. In general, we're less than 5 days on a lot of our reports turning around. There are a couple modalities which are longer, and we're looking at 2, 3, even sometimes 4 weeks. But I can't express enough that that's not okay with us, and we're actively working on getting that corrected.
But a peer hospital could be, of 7, 8 weeks.
Plus weeks for CT and MRI results at other facilities.
And we're not justifying it by saying, well, everybody around us is that, but I want our community to know that we were very fortunate and blessed to have the group that we had prior that were really dedicated. They only really had 2 major hospitals, us and another large system in Michigan, and they had a whole team that was dedicated. And unfortunately, because of the shortages and all the challenges and reimbursement, they went their own ways. But we were spoiled.
Yes, we were.
Because even when you had them here and we were talking, you were talking to your colleagues, I was talking to mine, they'd be like, wow, that seems remarkable that you have that good of turnaround times. And so we were, I'm going to say, pampered a little bit that we had that. We did not experience what the market experienced over the last decade, but now we are. And so we're working very diligently. I know that you and I have talked with the owner of the current company, and they're bringing someone else on. That will help speed this up. But Jamie, if there's a community member listening today that's frustrated because they didn't get, their reads in time, or they feel like they just really want a quicker turnaround time, or they have a question, what's the best way to go about and getting that answered?
I think the starting point would be calling the radiology department. Look into if there's a specific reason, if there's something we're waiting on that maybe your results have not been turned out yet. And then we can kind of keep in contact with the radiologist to try to push things along. And we understand that patients are waiting for these results. They have follow-up appointments they want to keep. We understand that workflow. So we want to do what we can to help.
And you've done a remarkable job at communicating that. Your staff has done a great job during procedures. And to the other notion that if I think that, well, I can get it quicker somewhere else, that is not going to be the case. So just bear with us. We apologize that there's a delay from what you're used to with the old group. Trust us, we'd love to be able to boast of 12 radiologists, but unfortunately right now we have 2 radiologists and an RPA that are in this team. We're looking at expanding that, but please bear with us. We appreciate your support, your dedication, your trust in us. We're working through this to try to reduce some of those times. I wish I could promise a date and time, but I can't. I can tell you it has made improvements from when we first started. And even with those improvements, we're still ahead of the curve when we look at our peers. So Jamie, hats off to you and your team for the great work that you've done. Let's talk a little bit about your department. Okay.
Sure.
So what does radiology do? Let's talk about some of the modalities. What does that mean? And are we like, subpar to other hospitals, or do we have technology that's just as great?
We don't have technology that's just as great. We have technology that's better.
I love it. I love
Absolutely
it.
better.
And I didn't set her up for that, by the way.
He did not. We have worked really hard to make sure that we have the same technology, if not better, that our competitors around us are having. If you have to travel far away to a large university hospital, we don't want you to have to do that. We do our best to have those services right here. So we have built an arsenal in our department of DEXA, ultrasound, mammography, CT, nuclear medicine, general x-ray, cardiac sonography. We have all of that right here. We have state-of-the-art CT scanner that's only about 2.5 years old. We have the latest and greatest with MRI as well.
Give our listeners a little preview of cost, if you could. What does an MRI cost these days, if you want to go out and buy one, roughly?
At least $1.5 million.
$1.5 million. And we have state-of-the-art.
Yes, we do.
Our last one was installed, 3? How long has it been since our last MRI was installed.
Since the last upgrade that we did to it was about 3 years ago.
3 years ago, yeah, and very costly. And then you had the new. So then we expanded, and we knocked out some walls, and you have a nice area now
for CT.
And CT was a newer machine that we installed as well. That alone was
close to $1 million.
Close to $1 million. Technology cost, but our commitment as a hospital, whether it's MRI, CT, imaging, whatever we're doing, is that we want the latest technology to make sure that our patients and our providers have access to the latest and greatest technology for those reads. And who likes them the most are your physicians, because they want to make sure that the imaging is sharp. They want to make sure your radiologists want to know that imaging is sharp. That's all very important. So as we think about other services, PET scan, I mean, I think that's a big opportunity for us in the future. Now, we've had some delays. Can we talk about those?
Sure.
Why don't you update our community, because it was going strong and then there's something happened.
Yep. So we were offering PET scan 2 days a month. Every other Saturday currently is what we're offering right now. But the mobile PET company that we used that came in had some issues with their mobile trailer. They had one that burned up on them, literally going down the road because it's a mobile PET, caught fire. So we had some delays in getting another one in here. And then we had some compatibility issues with that scanner. So we've now got something in place and we're moving forward.
So we have the technology.
Yep.
We have the radiologist. You have the techs, right? I mean, your department is almost fully staffed. And speaking of that,
no, we are.
Are you fully staffed now? Good.
I can't express enough how fortunate we are to have.
Well, I was going to say that because in most hospitals, when I'm around my colleagues, they're talking about, the departures of radiology staff and, they're really struggling. You have maintained a full roster. And when I look at your roster, I was just saying this on our radio program this week, it's pretty significant that you have a good number of your who have longevity here right at Hillsdale Hospital, decades of work, much like yourself. And that speaks volumes to the leader, and I think to what you're doing down there and trying to accomplish for our patients. So congratulations to you.
Thank you.
That is remarkable to say that you have a full roster. Let's talk a little bit about if a community member says, you know what, my arm's hurting, I'm going to come in and get an x-ray. Can one just walk in to get an x-ray? Talk to us about the procedure that a patient would need to take.
Sure. So x-ray, because it does involve radiation, is something that requires a prescription, just like any medication. So you would have to see a provider, whether it's through a walk-in clinic, our emergency room, or your family doctor, and they would have to review things to make sure that an x-ray is indicated.
Yeah.
They would write a prescription for you, and you would come to the hospital, check in, and they'd send you back to radiology.
So would I have to make an appointment in advance, or how does that work?
So general x-ray, if it's a x-ray, not a CT or MRI, nothing specialty, it's a walk-in basis.
Okay.
So
walk in, you'll wait, you'll go through that process. What would I need to schedule then? If I need to schedule, what does that look like?
So we have a wonderful radiology scheduling department. And so you would just call there if you had to schedule for something like an ultrasound, CT, or MRI. And then they would get you an appointment for you.
Yeah. And what are you looking at, just roughly, and you may not know, appointment times? We're pretty quick at turning those over, right?
Yep.
So within a week or two, we can get someone in?
Almost anything in our department is a week or less.
Good.
To get in.
Good. That's a great commitment. So let's do myth busting 101, okay?
Sure.
Number one, it is not a myth that you report up to Randy Holland, all right?
That is true.
That is true. That's a misconception by some, but a truth of others. And so let's talk about some myths here. Any exposure to radiation in medical imaging setting is dangerous.
Any radiation can be dangerous. That portion is true. In a medical setting, especially at a place like Hillsdale Hospital, you are dealing with trained technologists. They are professionals. And I like to use this as a reference so you understand the training that they have. An RN is a registered nurse. In our department, we are mostly RTs, which means registered technologists. So we do the same type of training, same type of clinicals, everything that they do. And one of the things we're specifically trained in is radiation safety. So we make sure that when we're taking an x-ray, you're always using the appropriate amount. The only time you'd really worry about danger from an x-ray is if you were going to some place where the technologists were inexperienced or not trained or not licensed, or if you're having repetitive x-rays for whatever reason. And that you have to say, did the benefit outweigh the risk?
Right.
If you have a condition that needs to be continuously monitored.
And that's a conversation you're going to have with your primary care physician. All right. Getting an x-ray can cause side effects of radiation.
Not from a general x-ray. You're not
Okay.
going to see side effects. It's not like, a nuclear weapon or something like
Yeah.
that where you would have
Yeah.
side effects.
Thank goodness it's not a
Thank
nuclear
goodness.
weapon. All right. So
Although we do have nuclear medicine
we do have
in our
nuclear
department.
medicine, but not weapons. All right. So, you know what? I'm feeling good. You know, I'm 45 and I'm a female. I don't need a mammogram. Lies. Those are lies. Misconception,
Yes.
right?
Yes. Having a mammogram annually, especially once you reach the age of 40, is the best way to catch breast cancer early on.
Yeah. And you have quite a busy practice of conducting these mammograms in our community. But what I really admire is the follow through that you and your team engage in for that population. You know, we have someone dedicated in women's health here at Hillsdale Hospital.
Yes,
And
we do.
I don't know if you want to talk a little bit about what that process is after there's been a detection.
Sure. So we have a diagnostic imaging nurse navigator,
Yeah.
Molly,
Yeah.
And she works with reviewing the results.
Yeah.
One, ensuring they went out to your doctor.
Yeah.
Two, speaking directly with your doctor if follow-up is required, and also speaking with you should you have any questions
Yeah.
if there's follow-up required. And she helps walk you through the process of what's next and get you in contact with who you need to be in contact with if there is follow-up.
Yeah. And if you can't get into contact with who you need to get in contact with, she's a Spitfire.
She will make it happen.
She will she ever make it happen? And she does that for our patients.
Yes.
She's passionate about our patients. And we're so thankful that she's here and part of your department. Okay. Another, is it a myth? Is it a truth? I can't get an x-ray while I'm pregnant.
You can get an x-ray while you're pregnant.
Okay.
Now, obviously, this is something you would discuss with your provider. Again, does the benefit outweigh the risk? There is minimal radiation with an x-ray. We can use shielding if needed. But, if you're looking at something like possibly having pneumonia and the doctor needs to know for sure and you're pregnant, well, you need to know if you have pneumonia so you can be treated. So
Absolutely.
we might do an x-ray for something like that. But that's always between the patient and the provider. What's appropriate for the patient.
My radiologist will give me the results. My radiology tech will give me the results same day.
Not true.
Right.
One, your technologist cannot give you results ever because they are not a doctor. While they look at these images all day long and may know exactly what they're looking at and what you may or may not have as far as a condition, they cannot legally give you the results. That has to go to your doctor. So the radiologist reads it, and usually around right now, less than 5 days. Most things is actually less than 3 days. With the exception of the two modalities. Yeah. And then you would follow up with your doctor for the results.
So how many times in your previous life before you became the manager had a patient said, can you tell me, what do you see? And it's frustrating, isn't it? Because you'd love to be able to, but
yes,
but you can't.
I would say it happened every day.
Yeah.
And the amount of times I would love to say, everything's fine, don't worry.
You can't even say that.
But you can't even say that.
No, you can't.
The best thing is to put a patient at ease. And it's frustrating when you can't even say that.
Exactly. Mm-hmm. So last myth that we'll try to bust here: all medical conditions can be diagnosed with a radiology exam.
False. And this is a radiology pun. We see this a lot in radiology reports to correlate clinically, which means compare it to the patient's symptoms that they're presenting with.
Yeah.
Just because we can see things in the body doesn't mean it necessarily matches what the patient is experiencing.
Right.
Having a provider hands-on and having an examination is great.
Yeah.
While we can be the eyes on the inside, that's not everything.
Yeah.
It also goes along with symptoms.
Right. So I would say, and have said at seminars, early detection is early prevention. And so we would encourage our community that if you're not feeling well, you've got some pains and areas that are new to you, go see your either orthopedic surgeon, your primary care. They're going to give you an order to get an x-ray, potentially, maybe even something greater. You will come into Jamie's department. You will meet some of the kindest, nicest people. And I'm being truthful. I mean, they're great people. And they put you really at ease. I've had numerous tests here and exams. It's just a wonderful environment. And what I often hear, Jamie, and the comment cards I get, that we're like this concierge medicine that we're trying to engage in, like it was called by one of my board members, country club care that we gave them through your department. And
Great.
she was just absolutely overwhelmed with the difference between Big Health, where she had been in the Detroit area, to coming to Hillsdale, and the difference. And it all started in your department in radiology. So hats off to you and your team for the hard work that you engage in every day. And
Thank you.
Our commitment to the public will be that we'll continue to work on the turnaround times for the radiology department, and for working with the radiologist, hopefully get the third radiologist onboarded so we can clean up some of those turnaround times, but please bear with us. We know that those results, an hour can feel like an eternity when you're waiting on something. And specifically, a week can feel like a year in some situations. But please know we are addressing this, and our turnaround times are going to improve. We are very confident of that. They've already shown demonstrated an improvement, but we were spoiled and we enjoyed something that unfortunately may not come back ever. But we're going to work towards encouraging our radiologists to get those reads done in a timelier manner. So, Jamie, anything else you want to add or any thoughts that you have?
No,
None.
I think you summed it up.
All right. And we'll open it up. Are there any questions? None. You have answered every question. Well, it's been great to have you in the studio today. And thank you for what you and your team do. Again, remarkable work each and every day. And, it stands in the balance of someone knowing what treatment they need is your department. And the care that you give and the timeliness that we can provide is important to you. And I know it is. So thank you for being an advocate to our patients.
Thank you.
Thank you, our listeners, for your participation. You coming to use our services, that's what sustains this hospital. And so we'd love to hear from you. You can listen to us every week here on live. You can listen to us on WCSR 92.1 on Fridays, 102.5 every Saturday, where we talk about what are the health happenings here in Hillsdale County. Also, there's an opportunity for you if you're looking for additional services, like what does Hillsdale offer? Go to our website, hillsdalehospital.com. You can learn about all of the services that we provide here. Maybe you're looking for a job. We have almost 40 open positions right now. A lot of those are entry level. So if you're looking for a great career at an award-winning hospital, U.S. News and World Report, top nursing home in America, Detroit News, top employer. There's all kinds of accolades that we can throw out that we've received in the last 12 months to confirm that this is a great place to work. 23 years for you. Had to be a great place, right? Only 15 for me. I'm the new guy compared to you, but it's a great place to work. If you're looking to change careers, looking for ways that we can help you with your education, look no further. HillsdaleHospital.com. Under the careers tab, you'll be able to find job openings. Apply for them. It's done electronically. Love to have you as part of the team. Maybe you just want to volunteer. Opportunities there as well. Randy Howland was on our program. Was he ever a few weeks ago, and talked about all of the volunteer opportunities that exist at Hillsdale, whether it is working in the gift shop or any area of the hospital. Some exciting things are happening in volunteers in the next few weeks. So if you're looking to volunteer, please do. And until we see you next time, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.